When you think about gut health, and this is part of why the book had all the different chapters, it wasn't just about this is the research, it's also about what can you do? Because the truth is, and I think diet is number one, so I will definitely go into that in more detail. But the truth is, how you sleep is also going to affect your microbiome.
Sure.
Whether you're exercising regularly will also affect your microbiome. So you have to kind of look at it holistically and look at your whole life, all of your sort of lifestyle activities and patterns, and whatever you're doing from hour to hour, like, is this something that's good for my gut or bad for my gut? So certainly trying to optimize things like sleep. Stress is a huge one, managing stress, because that can really affect your microbiome. All those stress hormones have a very detrimental effect on your gut health.
Hi, I'm Kelley Namiro. Welcome to the Balancing Chaos podcast, a lifestyle podcast where we'll talk about wellness, motherhood, and some really exciting things in between. My goal is to help you develop a lifestyle that promotes health, wholeness, and success. Through my conversations with our experts and guests, I hope to inspire you to live a beautiful, full, and joyful life as you navigate balancing the chaos.
All right, everybody, welcome back to another episode of the Balancing Chaos podcast. Today, we have the privilege of speaking to Dr. Roshini Raj, a graduate of Harvard College and NYU School of Medicine. Dr. Raj is a board-certified gastroenterologist with an active practice and holds a faculty position as an associate professor of medicine at the NYU Grossman School of Medicine. But that is definitely not all. Dr. Raj also has a very successful career as a TV personality and a medical journalist. In 2015, Dr. Raj founded the skincare brand that I'm sure so many of you have heard of it, TULA Skincare, a probiotic-based skincare line sold at Ulta, Neiman Marcus, and Nordstrom, to name a few. And her most recent venture, Age-Defying, is a digestive super supplement formulated with magnesium, fiber, and enzymes designed to help those who don't get enough fiber in their diet with better sleep and digestion. Welcome to the show, Dr. Raj.
Thank you so much. So happy to be here.
I'm really excited to have this conversation with you. This is a conversation that I have in my DMs, literally, or with clients at some point, almost every single day, about digestion and digestive health and bloating. And I think the last stat I heard, and you would know better, is like 1 out of 3 Americans struggle with digestive issues, or is it more than that?
Yeah, actually, the latest that I saw was up to 40%. So even potentially more than 1 out of 3. And I also think even more than that experience digestive issues sometime. The 40% is just like more regularly it's an issue. But I think we've all experienced at times in our life digestive issues. So it's something we can all relate to, which is why I think it's a great thing to discuss.
Absolutely. Absolutely. So when you are in your practice, and I love that you're at NYU, I went there for my graduate degree myself, an amazing school. But when you're in practice, do you see that most of the people who you're seeing and talking to are experiencing more like chronic bloating, constipation, or is it really all over the map, the different symptoms that people are experiencing?
Yeah, I think, we see everything in our GI practice, but I think some of the most common things for sure, the full-blown irritable bowel or just milder versions of that. So constipation and or diarrhea, bowel irregularity, and bloating, those are probably the most common things we see, especially in women. We see men as well. But then, of course, there's a lot of acid reflux, especially with our diet and the stressful lifestyle we're leading. We do, of course, colon cancer screening, because that's like everyone needs to get that at a certain age. And then, then things that are a little bit less common, but still we see a lot, Crohn's disease, ulcerative colitis, ulcers, things of that nature. But I would say the most common would be things like bloating, constipation, diarrhea, and then the acid reflux.
Okay. So I love that you mentioned the IBS, because that was something that for me, I was diagnosed with. I know a lot of the women and clients that I see in, their 30s, 40s, 50s are diagnosed with. And from my understanding, after like doing a lot of research on my own and trying to heal my gut, is that it's actually like really just like this catch-all term for like a bag of symptoms that we aren't really necessarily at the root cause of for a lot of people. Like maybe for someone it's hormonal, maybe for somebody else it's dietary. And so can you talk a little bit about what IBS is and how somebody who gets diagnosed with that can do a little more digging on their own?
Absolutely. And it is something it's incredibly common, but you're right. That still, we don't have very clear-cut answers about a lot of it, which can be frustrating for sure for patients and for doctors. But just to define our terms, so IBS or irritable bowel syndrome, exactly as you said, it's a diagnosis we basically make based on symptoms, because unfortunately, there isn't a test like a biopsy or a blood test or even a stool test that we can do and say, okay, yes, this test came back positive for IBS. We actually call it a diagnosis of exclusion, meaning if you came to my office and you had bloating and diarrhea, I would have to exclude some other things before I said you had IBS, like other things that we can test for, something like celiac disease or Crohn's disease, or a stool infection. Those things we can diagnose with tests. IBS we can't. So the way we diagnose it is if you've had certain symptoms, and those could include bloating, abdominal pain, diarrhea, constipation, several times a week for several months, then we would say, okay, we've ruled out everything else. These symptoms are very characteristic of IBS, so that's what we think you have. And then you're right, what causes IBS? There are theories, some are more proven than others, but it also can vary from person to person. We are learning more and more that a disordered or imbalanced microbiome probably plays a big role in many cases of IBS. And so this, what we call dysbiosis, or when you have more of the bad bacteria than the good bacteria, that can lead to a lot of IBS type issues. We think that for certain people, certain foods in the diet can certainly trigger IBS flares as opposed to cutting them out. And then stress definitely plays a role where there is a higher percentage of people who have IBS have anxiety or depression, but even just garden variety stress can bring on IBS flares. And the reverse, having IBS can cause you to feel anxious or depressed or stressed out. So there's an interplay there between the gut and the mind. And we certainly know there's a gut-mind axis that has a very strong two-way conversation going on a lot. So there are different causes in different people, or multiple causes can occur in the same person. And what I generally try to do with people when I first think they're having IBS, or if even you're home and you haven't seen a doctor and you're wondering about it, I do think looking at the diet first is a really good idea, and kind of keeping track of when you're getting your symptoms, what did you eat that day? Are there certain foods that are not agreeing with you or are, and even trying to cut out certain things to see if you feel better. Things like dairy, for example, or certain very gas-producing vegetables can make a big difference. And then, gathering that information and bringing it to your healthcare provider to get a more kind of detailed evaluation.
Yeah, I think that going to your doctor with more knowledge, is so powerful, because then that, takes away probably another visit that you'd have to do with them after they tell you to go do those types of things. And so I think that that's a really great tip for somebody who's going through something like this. And I feel like I can go so many directions with you, and I want to with this conversation. But the first thing that I'm really curious about, because one of the things that I do in my practice is a stool testing of certain bacteria. We look at inflammatory markers in the intestines. What do you think about those? Because I always want to hear different perspectives and different people's opinions about some of these things, like the GI map or GI 360, where they're evaluating different levels of bacteria that are going on in your microbiome as a way to potentially help solve some of these symptoms for people who can't get, a more concrete diagnosis than IBS.
Yeah. So, I think the fascinating thing about the microbiome and microbiome research is it's just evolved so much over the last 10 or even 15 years. And we do know, there's so many interesting studies looking at these particular strains are associated with this disease, or I saw something about insomnia linked with certain bacteria, certain types of bacteria, which is so interesting to me. I do think it's a little tricky with these tests, because sometimes, your stool one day may show a certain level of certain bacteria, and then you check it a few weeks later without changing anything, and it could be a little bit different. And I think that science is still evolving about specifically being able to say, because you're deficient in these bacteria, you should do X, Y, Z. I do think it can give you overall a general picture of the state of your microbiome, and is it generally more of an unhealthy profile versus a healthy profile? And then if it's an unhealthy one, what should you be doing? And of course, we'll talk about that, but probiotic-rich foods, maybe probiotic supplements. Fiber to me is kind of the best broad shot, which is what inspired me to start Yay Day, because it is such this this sort of wonder drug or wonder food, I should say, for your microbiome with the prebiotic fiber really fueling the growth of all of your healthy bacteria. So I do think they can be helpful. And I think also inflammatory markers are important because sometimes those can point to other issues as well. Things like I said, of a more serious nature. So I think they can be helpful, but I think it's hard to draw very specific conclusions based on like individual strains. I'm not quite sure the science is that accurate yet. Yeah.
Okay. That's super helpful. And I think that people should be, if they're concerned, obviously going to see somebody who's like more specialized and very, very knowledgeable like you in your training. So when we think about going from that next step of, okay, I'm nervous, I've been diagnosed with IBS, to that more like concerned, like, I feel like this might be more serious. You mentioned getting, a colonoscopy. How young should people be doing that? And how often should people be doing that? And even like to backtrack a little bit more, sorry to bombard you with questions, but like what is considered normal and what's not?
Yeah. Well, I'll take the colonoscopy question is easier, so I'll start with that one. First of all, yes, colonoscopy is sort of essential for everyone to get at a certain age because it's the best way to screen for colon cancer. And colon cancer is, amongst cancers, one of the most common causes of cancer death. In fact, it's the second leading cause of cancer death for men and women. So for the number one would be prostate for men and breast for women. So that tells you how common colon cancer really is. What's alarming is we are noticing now colon cancer rates rising in younger people. So we used to kind of feel like,
Actually, I might have heard you talking about that in the news.
Probably. I do talk about that, and we're all talking about it because it's somewhat shocking. Even in my own practice, I've been practicing now for 20 years. Early in my practice, if a 30-year-old, and certainly if a 25-year-old came to my office and they had some rectal bleeding, I would do probably like a shorter version of a colonoscopy just to be on the safe side, but I certainly would not expect to find anything. And these days, we're actually finding colon cancers in people in their 30s or even in their late 20s, which is a big change from what we're used to. So, but to answer your question, right now the guidelines say you should start having colon cancer screening with colonoscopy being the ideal test for that, starting at age 45. And that's actually relatively new. Just a few years ago, it was 50. So it has gone down to 45. But you absolutely should get one earlier if you're experiencing any strange symptoms. And the ones that we look for when we talk about colon cancer, rectal bleeding is certainly probably number one, but also a change in your bowel pattern. So if you've been constipated your whole life, then that's not necessarily something we need to worry about for colon cancer. But if it's something relatively new, or you've noticed the shape of the stool has changed, has become very narrow, abdominal pain, weight loss, these are all reasons to get a colonoscopy, even if you're very young.
Okay, great. That's super helpful. So like a drastic change is what you would want to be looking for besides the rectal bleeding that you were talking about. I think.
Yes, exactly.
I think a lot of us like get, health anxiety and we get really concerned and we get really scared and we're like, is this normal? And like, that's what was leading that other question that I was asking you around like, what is normal? Because I have a lot of women who will come to me and they'll be like, I don't go to the bathroom for like 4 or 5 days at a time. Is that normal? Or like when it comes, or like I get really bloated after lunchtime, like, and not necessarily that may mean cancer, but when it comes to our gastrointestinal health and it being optimal, because I don't want to be normal. I don't think you want your patients to be normal. I don't want my clients to be normal. What is optimal in terms of, because of how, and I think we'll go into this next, but like how our gastrointestinal health, like you said, it affects our mental health. It affects our sleep. It affects our skin. And so what is optimal?
Yeah, it's a great question because exactly like you said, you want optimal gut health. It affects every aspect of your body, head to toe, short-term, long-term diseases, like everything. So basically the way we define, if we're talking about bowel movements for one, is you want to be going at least 3 times a week or less than like 2 or 3 times a day. So in that range. But I think one of the most important things as physicians that we look for is how are you feeling? So if you're going, even if you said, well, I go every 4 days, but I feel fine. I'm not bloated. I don't feel sluggish. There's not painful when I do go. I'm not pushing or straining. And I've been doing that for the last 20 years. That's probably fine. That's probably normal for you. But even if you said, well, I go every other day, but it's a struggle and I get like sweaty when I'm doing it and I feel bloated, then that's not, even though it's not that infrequent, it's not normal and something should be done about it. So a lot of it has to do with how you're feeling when you're going or when you're not going. But there are certain guidelines in terms of frequency that we do try to stay within that range. And when it's out of that range, you definitely want to investigate why, what's going on. And then bloating is another thing. Like, yes, all of us have experienced, we go out, we eat or drink too much, and we feel a little bit bloated. But if it's happening frequently, that is something to also investigate. And it could be as simple as cutting certain things out of your diet, but it could be a sign of another issue that needs to be addressed.
So one of the things that you mentioned before that I've always wanted to ask like a GI doctor or a specialist in this area about with potentially trying to cut things out of your diet, like seeing if you take out dairy, does that help? What are your thoughts? Because I think there's so much information out there for people to consume. And a lot of it can be really misleading. And a lot of it could be not applicable to a particular person. For the person who's going through this bloating, constipation, these average symptoms that you tend to see in your practice, what are your thoughts on elimination diets and trying those types of things out? And if you were to do something like that, what's the best way to do it? How long do the foods need to be removed for us to notice a difference?
Yeah, I mean, I think, first of all, I'm always a big fan of discussing this with a healthcare provider, your nutritionist, whoever it is, because it can, like you said, it can be confusing. And sometimes it can almost backfire in certain ways, which I'll talk about in a second. But I think when it comes to cutting things out, I think there are a few things that are perfectly reasonable to try on your own. And one of them I would say is dairy, because lactose intolerance is extremely common. And in certain ethnic groups, it's almost ubiquitous by a certain age, like inevitable. So it's definitely worth.
What is it, like 70% of the population or something like that lacks the enzyme?
Yeah, exactly. And then in Asians, it's even higher, or African American. So it's definitely something worth trying. And the other interesting thing is it can occur at any time, at any age. So you may be like, oh, I'm not lactose intolerant. I've been fine with milk and ice cream my whole life, but maybe now you're not. So if anyone comes to me with bloating, I say, just cut out dairy for 5 days. There are tests we can do for it, but actually cutting it out for 5 or 7 days is just as accurate as the test. And it's a much, easier, less expensive way to do it. So if you notice a significant change in your symptoms in that time period, then you kind of have your answer. You are lactose intolerant. And the solution is to either cut out lactose completely, or when you are consuming lactose, take a supplemental, lactate chewable pill, which has the enzyme that you need to digest it. So that's the story with lactose. And if you don't notice a change in 5 to 7 days, then you probably don't have it. And you kind of have that answer and you can move on. So that's one that's easy to cut out. Gluten is a different issue because, when we want to diagnose celiac disease, there are certain tests that we do that if you have cut out gluten, we can't do, the test is not accurate anymore. So I have a lot of patients who come and say, well, I think I might have celiac and I cut out gluten for the last 2 months and I feel much better. Can we confirm if I have it? And I'm like, well, unfortunately, I'm going to have to ask you to go back to eating gluten for 2 months. And they're not happy about that because they feel so much better. But I can't, whether it's a blood test or even an endoscopy, which is kind of the gold standard way of diagnosing it, all of those will become normal if you really cut it out. So I won't be able to tell you, yes, you have it or no, you don't. So that's one that I say, keep in your diet until you see the doctor, because then they can do the test and tell you, more definitively if you have that. However, once your doctor does the test and they say, okay, you don't have celiac disease, we've done the test, you still may be gluten intolerant. And that's different from celiac, which is a true immune reaction to gluten.
Right.
So at that time period, it is okay and probably makes sense to try just cutting out gluten just to see if you are intolerant. So if you feel better when you cut out gluten, even if you don't have celiac, that might be something you want to avoid because you're gluten intolerant. But then you mentioned elimination diets, and there are some very kind of arduous, strict elimination diets that people put themselves on. And there's one called a low FODMAPs diet, which we actually use for irritable bowel and can be quite effective, but it's extremely restrictive. So first of all, it's not the first thing we go to because it is so hard to stick to. The second thing is it's not meant to be done long-term because it's so restrictive. It's hard to stick to, and you're probably cutting out healthy foods that you need for, nutrients and vitamins and all those things. So even that, or any kind of strict elimination diet, that I think you should do under some kind of provider's care and for a limited period of time. So it might be 3 weeks initially or 4 weeks, and then you start to introduce some of those foods you eliminated one by one to see which ones are troubling to you and which ones aren't.
Okay, that's super helpful. I agree. I think that doing an elimination diet like that with a provider and like under someone else's supervision, so you have the hand-holding, is really great. And I think I also really appreciate the advice of like, wow, like I didn't even know like 5 to 7 days is fast enough to understand like the dairy sensitivity. And so I think that all of that is really great information for those of our listeners who want to try, a couple things on their own before having that more detailed support.
Exactly. And the other thing, two things I'll say, one thing about dairy that I always find interesting is you usually think of lactose intolerance and dairy as causing bloating and diarrhea. That's kind of the classic symptom. But I've actually had a lot of patients, and this is well documented, who actually get constipated with dairy.
Yeah.
So it's something that people should try if they're constipated as well. And the other thing I want to just point out, because I didn't say before, is when you are trying things on your own, do them one at a time, because if you cut out 5 things and you feel better, you'll have no idea which one it is. So it's common sense, but a lot of people, they're like, I'm going to be super healthy, I'm going to cut out everything, and then they're kind of like, well, now I have this super restrictive diet and I'm not sure which one is the issue. And like, do I have to live like this forever? And so, yeah.
And I appreciate you saying that, because I can't tell you how many people come to me, after having done maybe like a food sensitivities test 5 years ago, and they're like, I feel like I literally can't eat anything. And I am like so restricted, and it's affecting my mental health, and I have anxiety around food and all of this stuff. So before we move on, because I do want to ask you about the FODMAP thing in a little more detail, is when it comes to those food sensitivities tests, can you talk a little bit about, because I think a lot of people trust them, a lot of people think they're super accurate. Talk a little bit about the accuracy of those things. And at least to my knowledge and understanding, those things can actually change. Like when it's not an allergy, but it's a sensitivity, those things can change over time. So can you talk a little bit about that?
Absolutely. And by the way, even allergies can change over time, but food sensitivities for sure. And first of all, number one, those tests are not always accurate. And so they shouldn't be sort of held up as this is the Bible and I have to do everything they say. And I think trial and error is important here, because especially if it's not a true allergy, it's not like you're putting your life in danger by trying a tomato, even though they said don't eat a tomato, So I think you have to really take them a little bit with a grain of salt. And the other thing is, even with allergies, and the allergist will tell you this, unless they see a sky high allergic reaction on a test, they're like, okay, the test says this, but when you eat, this food, do you feel bad? And people might say, no, I feel fine when I eat eggplant. They're like, all right, well, then it's probably not a very strong reaction and you're probably fine. So yes, I would say you can use them as a guide, but I would not drive myself crazy over it. And I definitely would try to reintroduce things. And as you said, you may have been sensitive before and now you're not, and vice versa. So I wouldn't say like this means it's off limits for the rest of your life.
And is that because the microbiome can change so quickly and over time?
Yeah, I think that's definitely a theory. And we know that the microbiome and changes can affect your immune reactions to everything, including foods and potential allergic reactions. So yes, I don't think it's necessarily been proven like definitively that that's why that's happening, but it makes a lot of sense. And I think we will see more proof of that in the future.
Okay. So one of the things you mentioned when we were talking about elimination diets just now was the low FODMAP diet, right? And one of the other things that we talked about was like, yes, there are people out there, the most common symptoms that we see, both of us, like constipation and diarrhea, bloating, but then heartburn, right? And that's kind of the other side of things, if you will. And so, I'm sure some people experience the constipation and diarrhea with the heartburn, but when we think about that, what's the root cause of the heartburn? And, I've heard there's people who talk about small intestinal bacterial overgrowth. I know with me, like right now, my heartburn is because of my pregnancy. So when people look a little deeper on that end, what's the root cause there?
Okay, so heartburn is literally what it sounds like. You feel a burning sensation in your chest.
Yeah.
It's a symptom of acid reflux. So, and acid reflux means the acid that's normally supposed to stay in our stomach, and it's important to be there, and it does certain things, including digestion, and protecting us from infections and all that. If that acid travels from the stomach up into the esophagus where it's not supposed to be, it can cause burning, it can cause irritation, it can cause damage to the lining of your esophagus. And all of that is part of what we call acid reflux. So why would acid travel from your stomach upwards? There are several reasons why this could happen. One main reason is there's a sphincter between your esophagus and your stomach that's supposed to be closed all the time, except for when you're swallowing food, because of course it does have to open when food is passing from your esophagus down into your stomach, but the rest of the time it's snug and closed, and that's what keeps the acid in your stomach. It's not able to splash upward into your esophagus. But if that sphincter relaxes too often or becomes weak for some reason, then it's much easier for acid to come up. And there are certain foods that will cause that sphincter to relax more often, and drinks. So things with caffeine in them will do it. Chocolate can do that. And then there are foods that are just acidic on their own. So citrus is a very acidic type of juice or fruit. Peppermint can also be quite acidic, and tomato sauce is acidic as well. So alcohol will cause that sphincter to relax. So there are definitely things in the diet can do that. Hormone changes can do it as well. So certainly in pregnancy, the hormonal changes that are going on can cause that sphincter to loosen. Even taking hormone replacement can sometimes do that. But even the pregnancy, the fact that you have pressure from the baby being in the abdomen, pushing the stomach sort of contents upward, that also makes you more predisposed to acid reflux. And of course, pregnancy is a very common time for women to experience it. There are medications that people take that can cause that sphincter to loosen. So there are many reasons why someone can get acid reflux. And yeah, it can be quite, distressing, but also can be dangerous because it can cause inflammation in the esophagus, which in very rare cases can even lead to esophageal cancer.
Oh, wow. Okay. Yeah. So I think there's like a lot even more for us to unpack there, right? When we think about heartburn, because I know that, again, like a lot of people are experiencing it. And you mentioned like things like there's certain foods or like hormonal changes. When we think about the one thing that I want to actually get clear on from you, because you mentioned like alcohol, when we think about alcohol specifically and how it impacts heartburn, is that something that affects, and I think I know the answer to this, but I want our listeners to hear it, all of the health of the microbiome? Should people with digestive issues be completely getting rid of alcohol? What does that look like?
Yeah, so alcohol is this, and everybody likes like their occasional glass of wine, and I understand that. And so I think for years we've been clinging to this notion of, well, in moderation, it actually could be good for you and all that. I think unfortunately the research on pretty much every body system or every health system connected, in terms of looking at alcohol, shows that none is even better than moderate drinking at this point. And I think that's very true for your gut health as well. So certainly alcohol is toxic to your digestive system. So it definitely can cause inflammation throughout esophagus, stomach, colon. We see ulcers caused by alcohol. It definitely can make acid reflux worse. I mean, I think the one thing that people point to is like, well, red wine does have some, healthy ingredients, specifically the polyphenols, and that is true. And those polyphenols technically are good for your gut. But you can get those in grapes, for example. Or even other fruits, right? So I think the benefits or the risks associated with alcohol outweigh the benefits. And I think generally speaking, and that being said, I mean, do I occasionally have a drink when I'm out with friends? Yes, I do. But to say like to do it regularly, I think you'd be kidding yourself if you thought that was in any way good for your gut health. Yeah.
Okay. Is that, and like when you think about like what we're talking about with elimination diets, like I think sugar and alcohol specifically, like, is that something that you would recommend to somebody? Like, I know you said like once in a while, but I'm guessing like as a gastroenterologist, and I could be wrong, but I'm going to take a wild guess and say your gut health's probably pretty good, knowing all the things that you know.
So, yeah.
If somebody was experiencing all these symptoms, is that something you would maybe tell them to take out for a little while?
Yes, for sure.
Okay.
And sometimes it's a very kind of urgent, like, I do endoscopies as well as colonoscopies. And so I can see what's going on in the stomach. And if it looks red and angry and irritated, I say like, for sure, no alcohol until we figure out what's going on or get your stomach healed a bit. And then most of the time it is more of a long-term recommendation as well.
Okay.
Yeah.
And is that the same with, because I think that we hear this a lot, and I would love for you to talk more about how refined sugar specifically plays a role in inflammation in the microbiome, but I'm just wondering if that's kind of like the same thing.
Yeah, for sure. I mean, we talk a lot about ultra processed foods in general and refined sugar for sure, as again, being pro-inflammatory and really disrupting the balance of your microbiome, which then triggers inflammation throughout the body. So those are definitely things that you want to keep in moderation or to a minimum as much as you can. And in general, the whole category of ultra processed foods, I mean, that's sadly part of the average American's diet, a large part of it. And that has been increasing over the last few decades, which is why most people feel that's why we're seeing a rise in so many chronic diseases, not just obesity, but other inflammatory conditions. It really seems to be linked to this very poor trend in the diet towards more ultra-processed foods. Less people are cooking for themselves. The ingredients we're buying are just more processed. And so it's just not a good equation right now.
I really hope that you are enjoying this episode. I want to take a quick pause and invite you to come deeper with us if you're ready to explore the root cause connection to the symptoms that you're feeling. Whether you're bloated, exhausted, maybe you have brain fog, you can't lose weight. The WBK Health and Hormones course and our WBK membership and app are here to help you feel like you are empowered to take charge of your health and understand the real why behind you feeling how you do. And we give you the methods and protocols to heal with sustainable solutions. Right now, through Labor Day, get 10% off our annual membership on the WBK app with the code Balancing Chaos, all one word, BALANCINGCHAOS, and 20% off the Wellness by Kelley Health and Hormones course, and an emailed lab review with the code Balancing Chaos 20. That's BALANCINGCHAOS 20. These protocols in the course have meal suggestions, journal prompts, and supplement guides to help you heal whatever area of hormonal balance you're struggling with. With our membership, you'll receive a library of content and new workouts, recipes, and meditations every single week to keep you consistent and to allow your body to come back to its most vital state of being. Okay, now back to the episode.
I actually read some crazy statistic in a book I'm reading right now. It's called Good Energy. And it was like 60 to 70% of the average American's diet is processed food, which is
it's really scary. And it's not like it's just the sign of the times, because it's not in all other, countries across the world. I mean, Americans are really the worst when it comes to that. And I'm sure you've had clients or people who've, traveled and eating, sort of similar foods, but in other countries, and they feel so much better because it's just not processed to the level that ours is here.
Yeah, you hear that all the time. Like, I went to Italy, I ate the pasta, I felt so much better.
Exactly.
So when we think about like, one of the things that we were talking about, or that you mentioned, I should say, was like this idea of how your gut health plays into, just the gut-brain axis. We think about mental health, we think about anxiety or depression. Like, we know that there's a connection there. And then we also know that like there's a connection with other chronic health issues, whether it is dementia, Parkinson's, some of these different autoimmune conditions out there. Can you elaborate on that a little bit and talk a little bit about why is it that the health of our gut is playing into these more chronic conditions?
Absolutely. So this is my kind of passion topic.
Yeah.
So I talk about it. So the second book that I wrote came out a couple of years ago, and it's called Gut Renovation. And it's all about how your gut microbiome does exactly what you just said, how it impacts every aspect of your health. both short-term and long-term conditions. And the reason why I chose the name Gut Renovation is I wanted it to be sort of this metaphor of just like you gut renovate a house and you have to remodel every room. The book is separated chapter by chapter, is named after a different room. So the bedroom chapter is all about how sleep affects your gut and vice versa. The home gym, same thing with exercise. The kitchen, of course, is about diet. And as I was writing this book, and I did it because I just been seeing more and more fascinating research about how the microbiome is affecting so many different aspects. So I did, I just dove into everything. And I'm like, any study that has to do with the microbiome, I want to know about it. And if it's a legitimate study, I want to talk about it in the book. And I just could not believe, like, I was thinking, okay, I'm curious if there's a link with dementia. And of course, lo and behold, there are some really good studies showing a link. And then I'm like, what about something like, rosacea or eczema, or what about psoriasis or something rheumatologic like lupus? I mean, literally, there's every condition you look up, you will see there's actually decent studies, not just random ones, showing that there are imbalances in the microbiome that are linked to these conditions. And it's not always clear which came first. So for example, are you depressed because your microbiome is imbalanced, or do people with depression then become imbalanced in their microbiome? Is there something about the depression that's affecting it? But the fact remains there is certainly a link between the two. And so how does it work? Why is the gut microbiome, importantly affecting all these things? The theory is, and some of it has been proven already, is when your microbiome is in balance, one of the jobs of these good bacteria is to keep the lining of your intestine healthy and intact and not leaky. So to really keep all the contents in the intestine, which could be food, but also bacteria, potentially harmful toxins, those are okay if they're in your gut, but they're not okay if they leak through the lining into your bloodstream. And what happens when you have an overgrowth of the bad bacteria and you have an imbalanced microbiome, that intestine starts to get weaker and leakier because now you don't have as much of the good bacteria, secreting these protective things that keep that lining like tight and intact. And that's when things start to leak through and trigger inflammation. And we now know that inflammation is kind of the root of all evils. We think heart disease is really an inflammatory disease. Even diabetes is an inflammatory disease in many ways. So that's the reason why the gut microbiome is so important and can affect every aspect of your health.
So leaky gut is a real thing for people.
Yeah. And I think it's, leaky gut has gotten a bad rap.
Yes.
For reason, in the sense that I think the term was sort of misused or overused. But in this particular instance, it's a very descriptive and accurate term of what's going on when we talk about why your gut microbiome, how it can affect inflammation.
So with all of that being said, and I want to talk about strategies when it comes to how are we going to heal this, but if that inflammation is impacting all of these chronic illnesses, right, or has a causative role, then it's safe to say that that same inflammation, the dysbiosis that's causing that inflammation potentially, is also impacting how we're aging, what our skin looks like, our beauty, our sleep, the symptoms that go along with these things before they turn into chronic disease in the long run. Is that right?
For sure, yes. And that's part of what, the subtitle of my book is very long, but part of it is talking about aging because yes, I mean, first of all, it's funny how people define aging, and some people think of it as just wrinkles and saggy skin. But I really think of aging as like, how many diseases are you going to accumulate as you get older? Because if you don't have any chronic diseases, you're probably going to feel and look very young, So I think just preventing chronic disease is a way to sort of stay young and healthy. But even things like wrinkle formation, and of course, we looked at this a lot with TULA, which was looking a lot at, microbiome and skin and the connection there. Wrinkles in many ways are because of inflammation. And the same thing with hyperpigmentation. And when you have inflammation, you lose collagen and you lose elastin in your skin. So absolutely, the inflammation triggered by dysbiosis can cause many of the signs of aging, including, neurologic sort of cognition and how fast you're thinking and all of those things, which of course we know is a potential sign of aging. How's your cardiovascular health? All of those things can be affected by your gut microbiome. So yes, even things like muscle composition, and they've looked at athletes and those who have the healthier microbiome profiles have more stamina and more endurance. And even non-athletes, they looked at populations at different ages. And, you and I have both seen that you can see a very frail, fragile, kind of weak looking 80-year-old. And then you can see a vibrant, energetic, supercharged 80-year-old. And they kind of compared people like that. And they saw that the supercharged 80-year-old had a much healthier microbiome profile than the more frail one. So I think it definitely can affect how you age and how you look, how you age, but also just how you feel as you age.
So yeah, like metabolism, energy levels, all of those things. I think those are like, truly, I'm such a big believer that those are the first signs of a chronic disease potentially coming on, are the symptoms that happen before. And so if somebody is like out there and they're struggling, they're not sleeping at night, they're gaining a lot of weight, they're super bloated, what are the things that they can do for their gut health, specifically for their microbiome, that are going to help with all of these symptoms that will then be preventative in the long run for some of these chronic diseases?
Yeah. So when you think about gut health, and this is part of why the book had all the different chapters, it wasn't just about this is the research, it's also about what can you do? Because the truth is, and I think diet is number one, so I will definitely go into that in more detail. But the truth is, how you sleep is also going to affect your microbiome.
Sure.
Whether you're exercising regularly will also affect your microbiome. So you have to kind of look at it holistically and look at your whole life, all of your sort of lifestyle activities and patterns. And whatever you're doing from hour to hour, like, is this something that's good for my gut or bad for my gut? So certainly trying to optimize things like sleep. Stress is a huge one, managing stress, because that can really affect your microbiome. All those stress hormones have a very detrimental effect on your gut health. And then, like I said, moving, being active, because they definitely compare sedentary people to active people, and they have very different microbiome patterns. But then I think diet is kind of the core of taking care of your gut. And with the diet, I think I always like to start with the positives as opposed to don't do this, don't do that. So what I would like to see you do more of is, number one for me is fiber. And that's part of what inspired Yay Day, of course.
No carnivore diet. It's Dr. Raj.
Yeah, exactly. Because plant-based foods and fiber is really the superfood for your gut. So those prebiotic fibers absolutely fuel the growth of your positive good bacteria. So we all have good bacteria in there. We may not have enough. And when you feed it with fiber, it grows and becomes plentiful and really helps your gut thrive overall.
But the bad bacteria don't thrive on fibers.
No, correct. Okay. Yes, exactly. And then probiotic rich foods. So fermented foods, because again, you'll get a nice mix of healthy bacteria as well. So I think those are two key components. And in my book, I have, recipes and just different easy ways to incorporate that into your daily diet. But there are other things like antioxidants, and we talked about polyphenols, other great components, mostly in fruits and vegetables, which can really also foster a healthy microbiome. So those are important. And then I do have to mention some of the don'ts, which is, we talked about alcohol, the ultra processed foods. I do think that, this is an obvious one, but should be mentioned, is antibiotics, because, they absolutely can destroy your microbiome, and unless absolutely necessary, should be avoided. And, we still live in a culture where I think people reach for an antibiotic often, thinking they'll feel better right away. And often it's not even going to work for what they have, and it can really cause a lot of harm. So that would be one thing to avoid for sure.
I love that you mentioned that, because I think that a lot of Western trained doctors are very much in the camp of antibiotic, overprescribing those things. And the fact that they're talking about the fact that, if you do it too often, it's actually going to be a negative rather than a positive. So
very much so. There are studies looking at kids who have had repeated courses of antibiotics as a child, like kids get ear infections and things like that. And then they see 10, 20 years later, a rise in or an increased risk of autoimmune diseases, things like Crohn's disease, it definitely has an effect. And it's not just on an individual. We are seeing the rise of resistant bacteria, in hospitals. These are things that are dangerous for society in general. So there definitely has been an overuse of antibiotics, generally speaking. And, now there are hopefully doctors and hospitals certainly are getting on board with trying to avoid it when they can, because we're seeing a lot of the dire consequences of overuse. Yeah.
Absolutely. And there are, there are times when where they're necessary, and I get it. And Western medicine comes into the rescue, but there are also times where, you don't need to take a Z-Pack for that cold that you have.
Exactly. That's exactly the scenario I was talking about. Yes.
The other question that now that we're talking about medication, and before we jump into skincare, that I want to talk about, because it just entered into my mind, is I'm really curious about your opinion, because I've heard, from different hormone doctors that we've had on the show, and different naturopathic doctors that we've had on the show about this topic of birth control pills and the impact of birth control pills on the gut microbiome. And I'm interested in what your take is on that.
Yeah, I mean, I think hormones in general and hormonal shifts, which are happening all throughout a woman's life, we can't catch a break on that one, but can definitely affect the microbiome. And I think they can affect them in different people in different ways. But generally speaking, I would say hormone replacement can negatively affect the microbiome at times. However, I think the benefits, I don't think it's harming it to a great extent. And so I think the benefits that women can get from hormone replacement in different scenarios far outweigh any potential downside that would happen to the microbiome. So I wouldn't say that's a reason not to do hormone replacement. For sure.
Yeah, I love hearing different perspectives on this, because you hear someone say oh, it's the worst thing in the world, and then you have somebody who's in your profession as a gastroenterologist who's like, no, it's not so bad. So I think that everyone else, taking the what they're considering, outweighing the pros and cons, and hearing from people like you, it's really great.
Yeah, I mean, it's funny. I'm thinking of the name of your podcast, balance chaos. And to me, that's sort of like what's going on in your gut. Because it's like all these bacteria, the good guys and the bad guys, and it's never going to be perfect. But as long as you can sort of keep it in some balance, then you're probably 90% doing what you need to be doing. So yeah.
I love it. Yeah. So one of the things that you mentioned was when we're talking just now about taking care of your microbiome and how that impacts aging. And that you started a whole skincare line that is filled with different probiotics and things like that. And I'm really curious as to I know that there is, and you are going to explain this so much more eloquently than me, but that we have some sort of, I'm guessing
microbiome.
Microbiome on our skin. Yeah. Is that right? And so
can
you talk a little bit about that and why your line, how that kind of helps to.
Yeah, absolutely. So our skin is our largest organ, and it is a surface that is covered with a microbiome, so a thin film of different organisms. Yeah. And you want to make sure that microbiome, just like your gut microbiome, is in balance. And so a lot of things that we can do to our skin potentially can throw that off balance. So harsh cleansers, for example, anything that changes the pH of your skin can change the skin microbiome balance. Just pollution and just walking in the street and being exposed to pollution can do it. And then even things
if your skin microbiome is off, is that acne or that's going to?
Yeah, it can manifest in different ways. I mean, breakouts could be one thing, but sometimes it's more subtle. And for example, I was surprised when I first saw this, but pollution can age someone's skin by, 10, 15 years, wow. They said. And the thought is, it's not just the toxic direct effect of the pollutants in the air, but how they affect the skin microbiome, which then causes, again, more moisture loss because your skin barrier is compromised. So you have drier skin, you have a breakdown of collagen and elastin, and those are the things that help keep your skin looking plump and wrinkle-free and all of that. So definitely your skin microbiome is a crucial part of how we age. And it's really interesting to me because when we started TULA, now 10 years ago, it's our 10-year anniversary coming up, nobody was talking about the skin microbiome. And I will say that I do know that, Clinique and other big brands were looking at it and kind of slipping it into some of their products because they knew it was something important, but not talking about it at all. They wouldn't advertise it at all. Right. We were the first brand that brought it to the forefront and said, this is actually something important for your skin health. And now, like, again, like the gut microbiome, the science has evolved so much that there's a skin microbiome conference every other week somewhere in the world. Like, it's become such an established part. And you have Aveeno and all these people on their commercials on TV saying, good for your microbiome. So it really has come into its own, which I think is great, because I think it is really an important part of skincare and just skin health in general.
Yeah, absolutely. So when someone's thinking about the health of their skin and they want to do, best job to take care of their skin microbiome, what are like I don't know, let's say like 3 steps that everybody should be doing for their skin?
Yeah. So one is, using a line like ours that actually has probiotic extracts in it, because that's kind of the most direct way to feed your skin the good stuff, is what we say. The second thing is, which may come as surprising or not, but is really in terms of what you're eating, because feeding your gut microbiome, as we talked about before, decreases overall inflammation. And that means your skin will be better off as well, because there's less inflammation triggering skin inflammation. So actually things like fiber, probiotic rich foods, and you'll ask women, and this is part of what triggered me to start TULA, is I saw in my own practice that people that were really taking care of their gut noticed that skin issues were improving. And so that for sure is a component in taking care of your skin, is watching your diet, avoiding the refined sugar, the unprocessed foods, the pro-inflammatory fluids, really avoiding them can help your skin. And then last thing is, yes, using products that are gentle on your skin and not really things that don't upset the pH balance of your skin. So really harsh chemicals. And you can see like certain products will tell you whether they affect the pH or not. And so
where would someone look for that?
You can use, basically, if they don't upset the pH, they'll talk about it, and we talk about it in our product as well. Most people won't say we do, but if it's like a harsh chemical, then chances are it probably will.
Okay. Yeah. Okay. That's super helpful. So all of your guys' products then are products that are going to be more gentle and more
very, and part of that is really the probiotic extract effect. Sure. That just has a very calming, anti-inflammatory, soothing effect on the skin. And that's why TULA, I think, has resonated so well with so many people and skin types, because there are many people that have tried other skincare lines and like their skin is broken out or they've had reactions, and they come to TULA and it's like the first line that's really agreed with them. And I really think it's the probiotic difference is what's differentiating us from other brands.
Okay. So for somebody who wants to go try TULA, where can they go to do that? And what is like the first product you would recommend that they buy?
Yeah, I mean, TULA.com is probably the easiest, but we're certainly Ulta, Sephora, and pretty much everywhere, Amazon. I have my regimen that I've used for many years, and I definitely have some newer products.
Her skin is glowing. Her skin is so dewy.
I'm also so hot right now, but thank you. Okay, so I'll give you and it's not that long or complicated, so it's good. So our cleanser, which was one of our very first products we launched, it remains, we call it the cult classic. It's actually the #1. Last time they did research on this was a year ago, the #1 cleanser in the US. So it has just like taken off like crazy. It's amazing. It's very gentle on your skin. It's not dry or stripping, but it's an awesome cleanser. So I start with that. I then use our Protect and Plump Moisturizer. So I'm 52. I'll be 53 in a few months, but so this is kind of more of our.
Let me just say, you look like you're like 32. So the fact that you like go buy her skincare.
It's working. It's working. Yeah. That and the Yay Day is helping my skin as well. So yeah. It's both. Our Protect and Plump is part of our ageless line. So we have something for a little bit more mature skin. That's what I use as my daily moisturizer. Oh, before I put that on, I use our serum, which is our Volume Defense kind of wrinkle serum. And then that's it at night. This is probably my absolute favorite product. I cleanse my skin again, and then it's called Beauty Sleep. It's an overnight, really rich, but not too heavy or greasy overnight moisturizer, which is just a gorgeous texture. And you wake up feeling like you just put it on, and it's wonderful. So it's a pretty simple regimen. That's what I use.
We'll link that in the show notes for you guys. And then let's talk about Yay Day for a second, because you mentioned that you take that. I think that I'm from what I was looking at, it has fiber in it. I would love, because we've talked about fiber multiple times in the show. How many grams of fiber should somebody be getting a day?
Yeah, so this is why we started Yay. 25 to 30 grams is what's recommended, and that's a lot of fiber. And stats show that 90% Americans, over 90%, are not getting that in the diet.
Yeah.
So most of us could use some help. And absolutely, I prioritize fruits and vegetables and fiber-rich foods in my diet, but I still feel like a supplement is helpful as well, and knowing that I can regularly get that every night. So I wanted to create something that was next level fiber. So it's a beautiful blend of different prebiotic fibers. Psyllium husk is one of the main ones, but we have oat fiber, flaxseed, inulin. These are all prebiotic fibers that we know are great for feeding your good bacteria. Also great for just bowel regularity in general. And we also know that fiber is great for cholesterol, blood sugar management, so many weight management, so many other things. But what makes us even more different is the magnesium glycinate component, because I really wanted to address the gut-mind connection and the fact that if you're not sleeping well, everything else in your life, including your gut, is in havoc. So magnesium glycinate is a great ingredient for calming and sleep inducing at night. So we wanted to put that in there. This is a product that's meant to be taken at night, which is also very different. And then lastly, the kind of third part of the triple threat is digestive enzymes, because I recommend fiber all the time, definitely every day, usually multiple times a day, because it's so good for many different GI issues. However, a lot of people don't adhere to that recommendation because they try fiber and they get very bloated. And so it's important to me to create a fiber without the bloating. And that's where the digestive enzymes come in, because these specifically are meant to help digest fiber in particular. So we're giving you fiber, but we're also giving you a way to digest it more easily. And it tastes great. That was another thing. Like traditionally, fiber has been this very old-fashioned, like, oh, it's something my grandmother just takes like a medicine. And when we wanted to make it a fun, pleasurable, like calm part of your evening routine experience. And that's what we're setting out to do.
I feel like this is like one of those things where, you know, I hear people talk about supplements all the time, whether it's on my show or people who are in my DMs, like who want to sell me something. And I appreciate this so much. One, because the magnesium form that you're using isn't just some like cheap oxide, you know, form of magnesium. It's actually the form of magnesium that's going to help you to sleep, which is beautiful.
Yes. And very well absorbed. Yep.
I was going to say, and then the fact that you're using these digestive enzymes to help people, because when you add too much fiber too fast, it will create bloating. So it's like, let's do this in a way that's actually going to help you get relief rather than make things worse. And it's all working synergistically together. I really love everything that you said about this. So yeah.
Oh, I'm so happy to hear that. Yeah. I mean, I feel like the gut health conversation and the products have become so complicated and sometimes overcomplicated that I didn't want to make a product that had 20 different ingredients and this herb and that whatever. I just wanted to keep it really simple. So I was like, what are the three things that I think are essential? And I was like, fiber, number one, digestive enzymes, so people can actually take the fiber and will continue to take it. And then I was like, let's not forget the mental aspect of it, because like I said, I see in my practice, like the mental and physical connection with gut mind is so important that I was like, I'd love to address that as well. And just with my own girlfriends, like they're not pooping or they're not sleeping or both. So I'm like, let me help them. Let me help them do all of those things and have a yay day. I mean, that's what the name is all about. So
love it. Love it. It sounds like an incredible supplement. And I urge everyone to go try your skin products and Yay Day. I think they both are amazing. So with all of that said, I have one final question for you. I know you're a very busy lady. You're just reading like about you and researching you and all of your incredible accolades and things that you're doing, the companies that you have, teaching, all these different things. Our show is called Balancing Chaos. And one of the things that you even have mentioned a few different times in the show is how like stress will obviously impact your gut health. And so with everything that you do and all of the different roles that you play, how do you balance the chaos and how do you manage that stress yourself?
Yeah, I think, it's a long answer, but I'm going to keep it really short. I think I learned a lot from my parents, who were both doctors and both worked really hard, but they also really prioritized having fun. And whether that doesn't have to be wildly partying, but just spending time with family or going to a music concert, or just, my mom loves to salsa dance now. She's 78 and she's going to kill me for saying that because she never makes me want to know her. But I think I really prioritize sort of enjoyment time in my daily life. So even if I'm running around and I'm busy, like I will make sure I've carved out, 20 minutes to be around when my teenage boys, who don't want to hang out very much, but the 20 minutes they do want to talk, I'm like, I want to make sure I'm there at that time. Or I have 20 minutes to read before bed, which I do most nights, or taking some like a 15-minute meditation in the morning and just doing some breathing. I think that is probably my number one. And the other thing is, I love what I do, and I'm very lucky to be in a position to really only be doing things I really enjoy. So even though people are like, you're starting another company, don't you want to take a break? Or I'm like, but I thrive on this. It like gives me energy to do these fun things. So that's definitely part of it. And also just not trying to be perfect. So, you don't have to say yes to everything. Accepting help when it's offered or asking for help, even if it's not offered, is super important. Not trying to be a superhuman being, because I do understand how stress and not sleeping can take its toll. And then the very last thing I'll say, and I don't want to sound like a, perfectionist, but I do think my healthy lifestyle and the way I eat and the fact that I do exercise and I do try to prioritize sleep, is what gives me the energy to do all of these things. Like, I don't think there's any way I'd have the energy to do it if I was eating, ice cream and French fries every day, which, if all the other things being equal, I'd love to do that if it didn't impact me, but I know that it does. And so I think, really trying to stick to a healthy routine as much as possible, it gives you such a reward in terms of your mental health, your energy, and your ability to just like do what you want in life. So
yeah, absolutely. It's like the habits that you have are what sets you up for the long-term success. And I think that so many people out there are so set on that instant gratification versus like, how do I want to feel next week, next month, like next year? And when you take that perspective, you're like, okay, I'm going to definitely choose the fruits and vegetables over the French fries. So I don't think that that's a bad thing at all. I think it's a wonderful thing.
Yeah. Good. I'm glad you agree.
Well, thank you, Dr. Raj. I so appreciate your time and all of your knowledge that you have shared with our listeners. If they want to find you and connect with you and learn more about your practice or and I'll link all of I'll link TULA and Age-Defying, but where can they find you?
Thank you. My website is gutrenovation.net. And then my Instagram is just Dr. Roshini Raj. So Dr. Roshini Raj.
Thank you so much for your time.
I really hope that you enjoyed that episode. You can follow me on Instagram at Wellness by Kelley, or head over to our website, wellnessbykelley.com. Sign up now for the Wellness by Kelley 7-day free trial on our app, or head over to our course and now get 20% off the course or 10% off of the membership with the code Balancing Chaos, all one word, BALANCINGCHAOS. In our course, you'll get access to an emailed lab review plus protocols built out to help you heal with whatever hormonal imbalance you're struggling with. With our membership, you'll receive a library of content with our app with low impact workouts, blood sugar balancing recipes, and mindfulness meditations, all designed to help you balance your hormones and help you feel like you are living your most beautiful, joyful, and vital life. If you like the show, please leave a rating and review. That is the best way to help the show grow and get to more listeners. We hope you enjoyed, and I will see you next week.